am Chelsea Faye M. Velarda, and I am a first-year nursing student of Davao Doctors College. Today, I will be assessing the skin of a patient because Doc Kahis is not around. I was instructed to do it instead. Since I really don't have any background about this patient, I will first review the patient's previous medical record. Okay, so now that I have enough background about my patient, allow me to share to you all the necessary equipments that I have prepared for this assessment. Okay, so here are the necessary equipments that I will going to use. The first one is the Comprehensive Health Assessment Form. This is where I will write all my findings about the patient, and of course a pen and a pen light. Since I really don't have a pen light, I will going to use the flashlight instead. And this is to ensure the adequate lighting and for better visualization of the patient's lesion. So next is the centimeter ruler. This is used to measure the size of a patient's lesion. And next is a drape. This is important to cover the body areas which are not being assessed. And next is the examination gown. This is to ensure the patient's comfort. And next is the working gloves. This is to ensure the safety of ourselves as well as our patient. Lastly, the alcohol. It is very important to sanitize our hands before we deal with our patients. Now that we're all set, let us proceed into meeting my patient. Good afternoon, ma'am. Ako di ay si Nurse Chelsea. Ako mag-assess sa imo karon since Doc Kahis is not around. Is that okay with you? Okay, so unsay name na to, ma'am? Okay. Kanusang birthday, ma'am? Uy, hapit na. Ano ko sa wristband po? Okay. Unsa may gusto nimo itawag na ko sa imo, ma'am? Okay, Miss Ann. Miss Ann, ako ang i-assess imo karon ng imong skin, ang imong hair, imong nails. Don't worry, kay dali lang na siya, di na siya maabtan og 10 minutes. And of course, i-ensure jud nako ang imong comfort throughout this assessment, okay po? Okay. So, pwede ta mag-change into examination gown para mas comfortable jud ka throughout this assessment. Okay, thank you po. Okay, so now that the client have already changed into her examination gown, let us first ask if she has any concern, any clarification, or any question that she has in mind. And ask if she is okay to ensure the comfort of the client. Okay, ma'am, so before ta mag-start sa itong assessment, na kay question, clarification, or concern? Okay, so wala. Ma'am, okay lang ka or kailangan ba na ko i-adjust ang atong temperature para mas comfortable ka? Itugnaw ba ka? Okay, so ako ito ka question, ma'am. Wala ba kay history of skin cancer? Okay, so always ba kagapainit, ma'am? Okay, so dili kaayo. Kung maggawas-gawas kang magpainit ka, do you use sunscreen or any protection? Nagapayong ba ka? Okay, so wala. So ma'am, it is very important to use sunscreen or any protection for you to avoid having skin cancer. Okay po? Okay, so now let's start, ma'am. Okay. As we can see, the patient's hair color is brown, and according to her, it's natural. She didn't apply any hair color or haven't undergone any hair treatments. The length of the patient's hair is just above the shoulder. Okay, so let us first assess for the patient's head and scalp. Ma'am, touch na ko imuhang head, ma'am. Okay po? Okay. Okay. Okay, so the patient's scalp is clean and dry. However, sparse dandruff are still visible on this side. The hair is smooth and firm, somewhat elastic. No lice and no lesions and no scars visible on the head. Ma'am, palpate na ko imong head. Is it okay? Okay. Na ko ma'am kung sakit ha? Sakit, ma'am? How about ear po? Okay, ma'am. Tarong mo punta lingkod, ma'am. Okay, very good. Very, ma'am, sakit. So the patient didn't feel any pain. The head size of the patient is normal, no bald spots and no lesions. Now let us assess for the patient's forehead. Ma'am, i-wrinkle na to ato ang forehead, ma'am. Okay. Okay, so the patient has symmetrical forehead wrinkles, which is good for her motor cortex. Now let us check for the patient's palpebral fissure and nasolabial folds. Ma'am, chin up po tayo. Okay. So the palpebral fissure of the patient is symmetrical and normal. Ma'am, could you smile for me, please? Okay. So the presence of the nasolabial folds are present and symmetrical on both the left and the right side. Let us now check for the patient's eyebrows. Ma'am, may I see your eyebrows? Okay. So the patient's eyebrows are symmetrical on both the left and the right side. Can I touch it, ma'am? The distribution of the hair are normal and symmetrical on both the left and the right side. Let's proceed into checking the patient's eyelashes, eyelids, eyes, and sclera. Ma'am, could you please close your eyes and now open po? Okay. So the patient's eyelashes are evenly distributed and both symmetrical on the left and the right side. I also observe that her eyelids are symmetrical on both the left and the right side. Ma'am, blink po tayo twice. One. Okay, one more. Okay, so the patient has no trouble in opening and closing the eyes. Ma'am, look po tayo sa left and sa right po. Okay, so the sclera is normal. It is white and I don't see anything of concern at all. Now let's proceed into assessing the patient's palpebral conjunctiva. Okay, so ma'am, could you please look up for me? Remember to use gloves when doing this. Okay. So the palpebral conjunctiva of the patient is pinkish in color. There's no swelling and no presence of foreign objects. Let's proceed into checking the patient's lacrimal gland and nasolacrimal gland. Okay lang ma'am, touch na kayo ng face. Okay. Okay, so the patient's lacrimal gland is normal, no swelling at all, which is very good. Let us check for the patient's nasolacrimal gland. Touch na ko usap, ma'am. Okay. Sakit, ma'am. So the patient didn't feel any pain while I touch it, and there's no presence of swelling at all. So now let us proceed into checking the patient's ears. Okay, ma'am, check lang na po yung ears if leveled siya sa imuhang side sa eyes, okay? Okay. Okay, the other side po. So the patient's ears are both leveled on the sides of her eyes. Now I'm gonna palpate the patient's cartilage and mastoid process. Touch ko usab, ma'am. Okay. There seems to be no problem with the cartilage. Now the mastoid process. Sakit, ma'am. Okay. There's no swelling. And the mastoid process is normal, no masses. Both the cartilage and the mastoid process are normal. Now let's check for the patient's ear canal and tympanic membrane. Ma'am, check na po yung ears. Okay. Do you feel any pain as I'm pulling it? Okay, very good. The other one. So both the patient's ear canal is in the same color with the ears. There are no presence of foreign bodies, and there are presence of cerumen or wax, which is totally normal for the patient. Now let us proceed into assessing the patient's nose. Okay, so the patient's nose seems to be on midline, and the septum and the nostrils are normal. Please look up, ma'am. Okay, so the color is pink and it is moist, which is perfect. Okay, so now I observed here that the patient's lips are pink in color and are both symmetrical on the left and right side. There are no signs of lesions, no bleeding, and no edema, and also no cracks or any problem with the lips. Okay, now ma'am, could you please stick out your tongue? Okay. May I see underneath it? So the patient's tongue is moist and pink in color. It's not dry nor cracked. I didn't see any sores or any lesions underneath her tongue. Okay, so now let us proceed into checking the patient's oral cavity. Ma'am, open tayo ng mouth. Yes, wide po. Okay. Okay. The mucous membrane and the gums of the patient is white and is shiny. No presence of cavities, no broken teeth or loose teeth. Now let's proceed into checking the patient's chin. Touch ko po, ma'am. Okay. Masakit? Dito po. So the patient didn't feel any pain. I observed there's no lesions and there's no swelling of the lymph nodes. Okay, so now let us proceed into assessing the patient's neck. Bend po natin yung neck natin, ma'am, sa left. Okay, the other side. Do you feel any pain? Okay. So the patient can do it effortlessly with no pain. How about i-lean naman natin forward and then backward? Have you had any trouble doing it? Any pain? Okay. So the patient didn't have any trouble doing it and she felt no pain, which is good. Now let us palpate your neck po. You feel any pain? She felt no pain as I palpated, and there's no lesion and scars palpated. Let's now proceed onto assessing the patient's upper extremities. Ma'am, could you please lie down there? Okay. So now that the client has already put into her lying position, let us check for her mobility and turgor. Ma'am, pinch lang po ako, ma'am. Slight lang po. Okay. Okay, so the skin is normal with elasticity. I didn't see anything suspicious. It returned to its original shape quickly. As we can see, the patient has a naturally fair skin, which is very common in most Filipinos. Now let's go on into assessing the patient's shoulder. Ma'am, check ko lang po yung shoulders. Okay. Touch ko po, ma'am. Nag-shave po kayo sa underarm niyo, ma'am? Okay. Nag-apply. So the patient's skin is smooth. It's warm. However, I observed that there are uneven skin tones, especially on this part. It's not dry, it's not rough, nor flaky. And according to the patient, she plucked regularly, which is very evident in her axillary hair because it is very thin, and I observed that there are no foul odor, which is very good because the patient has a very good hygiene and there are no lesions palpated. And now the other side. Check ko po, ma'am. Okay. Okay, so the other side is also normal, which is the same with the other arm. There are no lesions palpated. It is warm and it is soft. Now let's check for the patient's hands and nails. Ma'am, check ko po ulit. Okay. Wala ka pa colors sa imong nails, ma'am? Wala. Okay, other one po. Okay. Okay, so both hands of the patients are warm, and the nails are smooth and firm. The nail plate are firmly attached to the nail beds. No lesions, no clubbing, or any signs for cyanosis. However, I observed that there are white spots or dots along her nails. Now let's proceed to capillary refill test. Ma'am, pinch lang po na ko slight ang imuhang nails. 1, 2. Okay. So the pink tone immediately returns to blanched nail beds when the pressure is released. Now let's proceed into checking the patient's chest down to the abdomen. Check na ko, ma'am. Isbog na ko gamay ha para makita imong chest. Ang chest na. Palpate ko, ma'am. Okay. Do you feel anything? Okay, so there's no lumps in the patient's chest, no lesions palpated, or any abnormalities. And now the abdomen. Check ko, ma'am. Palpate ko ha. Okay. Do you feel anything? Any tenderness? Okay. So there's no visible signs of scarring. She doesn't feel any tenderness, which is good. There seems to be no body sores and any freckles. The color is even and normal. And now the lower extremities. I will ask her about the hair growth of her private area. Okay, so ma'am, may I ask if do you shave regularly or do you notice any changes in the pubic growth? Okay. So the patient reported that she shaves regularly and she doesn't seem to notice any abnormal growth within the area. Now let's check for the patient's legs. Ma'am, check ko po yung legs nyo. Okay. Okay. Okay, so the skin here is soft, no lesions or any skin problem, no scars as well, nor inflammations. I really don't see anything of concern in this area. Now let's proceed into the patient's feet. Check ko, ma'am. Okay. So the skin here is normal. It's thin but callous, which is perfectly normal, especially for areas which are exposed to constant pressure. Now let's check for the posterior part. Ma'am, could you please switch on to the other side? Okay. Now that the client has already positioned, let us assess for her posterior neck down to her feet. Okay, so ma'am, are you okay there? Do you feel comfortable? Alright, so let's start. Okay, so ma'am, palpate na ko imong likod ha. Do you feel anything? Any tenderness? How about here? So the skin here is normal. It is warm. There's no signs of lesions, any scars, abnormalities, or any lumps. Okay, so it's all good. All findings seems to be normal. No complaints of any tenderness or any abnormalities. Okay, ma'am, we're all good. Lingkod sa tadari kay maghatag pa ko nimo gamay comments and recommendations. So now I will discuss to the patients the comments and the recommendations that I have for her and discuss to her the things that she needs to do to maintain her health. Okay, so Miss Anne, I really don't have any serious comments about your condition because you have a normal skin, your normal hair and normal nails. Regarding the white spots on your nails, I will inform Doc Kahes and I will let her discuss it to you, okay? And the only thing that I recommend that I want to remind you is to magamit ta og kaning sunscreen every time mo gawas ta para mas protected ta mas maiwasan po nato ang pagkakaroon og skin cancer. It is very important to use lotion pod para mas moisturize atong skin, although smooth naman imong skin pero mas para mas ma-maintain nato na use ta og sun lotion. And of course pag come sa imong sparse dandruff kay nakita ko sparse dandruff sa dire nga side sa imong head, so it is very important to wash it thoroughly, to kuskuson og maayo para walay residue mabilin. Okay po? Okay. So, do you have any question, any clarification, or any concern bago nato na i-end? Okay. So, wala na, ma'am. Okay. So, thank you very much, ma'am. I will inform you sooner kung na may question or any comments si Doc. And, thank you very much sa imong cooperation and thank you kay very responsive kay ka. Okay, ma'am? Okay, thank you very much po.